Hello, everyone. My name is April Rain, and welcome to episode 3 of Healthcare Voters' new web series, What's at Stake, where we're exploring the pressing healthcare questions on your minds right now. In episode 2, we heard from policy experts, organizers, and patient advocates about what's at stake for the millions of Americans who are struggling to afford prescription drugs because of the organized crime of Big Pharma. Today, we're diving into a timely and massively important topic: gender, healthcare, and the Supreme Court. I would be remiss if I didn't take a moment first to reflect on the passing of an American icon and fierce lifelong champion of protecting our healthcare before the Supreme Court, Justice Ruth Bader Ginsburg. Justice Ginsburg's legacy speaks for itself and for the state of our nation. We are able to access quality, affordable health care, including reproductive health care, in no small part because of Justice Ginsburg's dedication to a healthier, more just America. May her memory be both a blessing and a revolution. It is especially timely that today's discussion will focus on the very nexus of gender, health, and legal battles to which Justice Ginsburg always dedicated her mind and heart. Today, we'll hear from some of our nation's top experts about what's at stake at the intersection of gender, healthcare, and the Supreme Court, especially now that Donald Trump is attempting to fill Justice Ginsburg's vacated seat with Amy Coney Barrett, someone whose legal philosophy is the complete antithesis to Justice Ginsburg's. To talk about this today, I'm excited to introduce you all to Chris King, the co-founder and chief counsel of Demand Justice, Elizabeth Wydra, the president of the Constitutional Accountability Center, Jacqueline Ayers, vice president of Government Relations and Public Policy for Planned Parenthood Action Fund, Monifa Bandele, senior vice president of Moms Rising, Daniel Goldberg, legal director of the Alliance for Justice Action Campaign, Attorney General Dana Nessel from the state of Michigan, and Senator Chris Murphy from Connecticut. First, we're going to hear from Michigan's esteemed and beloved Attorney General Dana Nessel. AG Nessel, we're so grateful you're joining us today to talk about what's at stake for our healthcare in the context of gender identity and expression in the courts this year. I'll hand things over to you.
Thank you so much for having me. I really appreciate the opportunity to speak to everybody today. I wish I was under better circumstances, quite honestly, but I think it's incredibly important that people have an up-close understanding of what the change in the court can mean and how we can prevent some really disastrous events from occurring by voting this November. So I just want to take a look for a second at my state of Michigan. And my state, the way things will work, pretty emblematic of many, many states all across the country. So previous to becoming Attorney General, I was a civil rights attorney, and I brought a case in Michigan, which actually overturned the ban on same-sex marriage and adoption by same-sex couples in Michigan. It ultimately went to the Supreme Court. You know it as Obergefell v. Hodges, and that brought marriage equality to states like mine and also nationwide. That was a 5-4 decision. And since that time, of course, there's been a change in the courts. Now, the difference between Justice Roberts and a potential Justice Amy Coney Barrett is that at least Justice Roberts believed in the concept of stare decisis, which means once something had been decided and was a precedent, he's not anxious to overturn things right away. Amy Coney Barrett has indicated she doesn't believe in that, and she's totally prepared to overturn cases immediately should she become confirmed. So let's talk for a second about the case that I brought and how that impacts people. So we now have 500,000 same-sex married couples all around the United States now. 6 in 10 same-sex couples are actually legally married in the United States of America. Most of them in states like mine, where it's still technically unconstitutional for same-sex couples to get married. It's part of our Constitution, was passed in 2004, has only been rendered legal by the Supreme Court decision. And I will say that shortly after the case, I got married to my wife, and she was able to legally adopt our 2 children. Here, sorry to do this to you guys, but this is our family. Can you see it? That's me, my wife, and
And
our
we
two
know
kids. They're super
we
cute.
love the family pics. Thank you.
But anyway, what will happen is this. Someone, once she's on the court, I have every expectation that someone will bring a new challenge. Yes, it'll get knocked down in the lower courts, but then it'll get appealed to the Supreme Court, where Obergefell v. Hodges is very, very likely to be overturned, rendering families like mine legal strangers to one another once again. And so in states all across the union where the law does not specifically permit for same-sex marriage, and that's most of the states, same-sex couples will no longer be married, and future marriages will not be permitted. And also in states like mine, children will not be allowed to have two legal parents in the event that their parents are a same-sex couple. And you know what I'd like to say to Amy Coney Barrett is this. Here's my message for her. You will rip this wedding band off of my dead gay cold hand, because I'm not okay with that. I'm not going to just sit down and roll over and allow you to take my legal family away from me that I fought so hard for, and so many people fought so hard for so many years. But it's a reality that we're now facing. In terms of abortion, let me talk to you not just about abortion, but actually about birth control as well, because justices, potential justices like Amy Coney Barrett have indicated very clearly that they don't believe in right to privacy protections that have been afforded to us. So those aren't just abortion cases, they're also birth control cases. So not only could we go back to the 1970s in terms of revisiting Roe v. Wade, we could go way back further than that, revisiting cases like Griswold v. Connecticut that even allowed us to have legal birth control distributed in our states. And in Michigan, for instance, abortion is still a felony on the books. That means that a woman or her doctor could actually go to prison for 4 years for having an abortion. And in the event Roe v. Wade is overturned, boom, the legislature doesn't even have to do anything. Automatically, it becomes a felony offense, and anybody could go to prison for it. And in addition to that, let me bring up one other case. The ACA, which I know is going to be a topic of conversation and everyone's very interested in. There is no question in my mind. I am one of the states that is defending the ACA. Remember, Republican AGs brought the case to bring down the ACA. And the Trump administration supports that effort. The Department of Justice refused to defend the law, which is generally their job. And so it's up to states like mine and Democratic attorneys general all over the country to defend the ACA. But in the event the ACA is overturned, which quite honestly, with Amy Coney Barrett on the bench, it absolutely will. The only reason it still stands is because of a 5-4 decision several years ago, where Justice Roberts sided with the Democratic liberal justices. We're talking about 23 million Americans that will immediately lose their health insurance, and an additional 135 million Americans with pre-existing conditions that can now be denied affordable health care. So this is very serious consequences. But the good news is this: there is a remedy to all of this. Will the court be horrible? There is no question that with the loss of Ruth Bader Ginsburg and the addition of Amy Coney Barrett, it will be a totally different court. But that being said, the solution is this: if we have a Democratic Senate, a Democratic majority House, and we win the White House and put Joe Biden and Kamala Harris in there, what that means is that we can actually pass federal laws that will affect every state in the nation, so that we can have legal abortion in all 50 states. We can have marriage equality and same-sex adoption be the law in all 50 states. And with just a mere few tweaks, one sentence could be tweaked to the ACA so that it no longer would be defeated in the courts. So I would like to say it's an easy solution, because it means that we all have to turn out to vote. We have to get every single person that we know out to vote. But if we turn the Senate and we keep the House Democratic and we win the White House, then all of these terrible fates that await us on these very, very important issues, we can avoid, fortunately. So I guess I tell you this not to scare you, but just to let you know how high the stakes are for people all across this nation. And that's why I am doing everything in my personal capacity to spend every moment of every day between now and 8 p.m. on November 3rd. And then thereafter, since there's likely to be litigation, ensuring that we turn the entire nation blue so that everybody can be protected.
Thank you so much, Attorney General Nessel, for joining us and sharing your perspective on what's at stake in the courts for our healthcare, and for framing it with Justice Ginsburg's legacy and people of marginalized gender in mind. I'm not sure that a lot of people are thinking about the fact that in some cases, if the law has not been codified in the state, one decision by the Supreme Court can turn everything around. And it's not scare tactics, but motivating factors, hopefully, as people are thinking about making sure that they are registered to vote and will be voting early and ensuring that their ballots are in time. I also want to thank everyone who's tuning in today to this important conversation. Please like and share this live stream, and we welcome questions for our speakers in the comments. Now we'll kick off our next segment of the show called Our Healthcare Stories, during which we'll hear from some amazing advocates about the fight for gender equity in our health system and the role of the courts. I'd love to introduce Jacqueline Ayers, the Vice President of Government Relations and Public Policy for Planned Parenthood Action Fund, that's definitely a mouthful, and Monifa Bandele, the Senior Vice President of Moms Rising. We'll start with an important question for everyone, and I'd like to start with you, Jacqueline. What makes you a healthcare voter?
Hi, April. Hi, everyone. Thank you so much for having me. This is just amazing opportunity and moment that we're in. The fact that just a few days ago, we were mourning and grieving over the loss of Ruth Bader Ginsburg, but unfortunately, we don't really get a lot of time to grieve and reflect on her legacy. We are already in the fight for this vacancy, and healthcare is central. It's what's on the line here. I'm a Black woman who was raised in the South, and what healthcare means to me, it is that I have a father who's on dialysis, a mother who has high cholesterol. I have family who live in one of the only Southern states to expand Medicaid because of the Affordable Care Act. And my family rely on Medicaid as their only source of healthcare. And I do this and work and so passionate about healthcare access because we know that healthcare should be accessible to everyone. It should not depend on your zip code. And I also do this work, and we think about this because of the work of Planned Parenthood patients. Planned Parenthood serves 2.4 million patients every year in our nearly 600 health centers. And I'd love to just share the story of a patient, Kat in Montana. Kat shared with us that back in March when COVID started, she had lost one of her two jobs. And that meant losing a large portion of her income. And by July, that second job still didn't come back. Savings were depleted and beginning to have multiple worries about the ability to afford healthcare. So she had to think about what are her options. She really wanted to work for a birth control option that was long acting because she says, I didn't know who was going to be elected in November if I'm still going to have these healthcare options. I thankfully knew I could turn to my local Planned Parenthood. I had a telehealth appointment quickly scheduled, and I met a nurse practitioner who talked to me about all of my options, listened to my concerns, understood, and explained. I explained while I was nervous about getting an IUD. I ultimately, after that conversation, decided that's the best option for me. And when my IUD was inserted, I had an amazing experience. I never felt more safe and comfortable at an appointment. Despite being a college student who had lost a large portion of income due to COVID, feeling like I was really lucky to be able to afford care that worked for my body. That story of Kat sharing her access to her preferred method of birth control at no cost is because of the Affordable Care Act, the provision that ensures access to no copay birth control. And we have to make sure that the ACA is protected because there's people like my family, people like Kat, who will immediately lose access and have more barriers to care.
Thank you so much for that. And we know that the copays for birth control, for those who choose to use it, can be exorbitant. And so especially, college students like Kat shouldn't have to choose between buying their books for a semester and getting the healthcare that they need. Monifa, I'd love to turn to you as the Senior Vice President of Moms Rising and ask you, what makes you a healthcare voter?
Yes, you're going to see a theme here. Also, as a Black woman, my mother grew up in the segregated South in Texas. And what makes our family so close to the fight for access to healthcare is that my maternal grandmother, who I never met, I'm one of those people that are like, you look just like Gus everywhere I go. So I feel very close to a woman who I never got an opportunity to meet because when my mom was small, they attempted to take her to receive care at hospitals in South Texas when she was critically ill with cancer. And she watched her own mother be turned away from healthcare, having access to healthcare. So all of her descendants, that generation of my mom and all of the grandchildren of Augusta Francis, we are really fired up to make sure that that never happens to anyone again. And so access to healthcare, access to affordable healthcare, and also to not have discrimination within the healthcare system is really important to us. One of the things that we work on at Moms Rising is actually the rising tide of maternal mortality in the United States. And it just really hits home. But in this year in particular, I also have a story of members and why we're fighting hard every day. At Moms Rising, before I came into this panel, we talked about, what are the stories at the forefront of the fight to protect the ACA? And there was Barbara from Georgia. She struggled for 6 years to keep her daughter, who has type 1 diabetes and other metabolic disorders, alive. And so it was the ACA that saved coverage through her state so that she would have a pre-existing condition insurance plan. This is life-saving, the ACA. We have Elaine from Kansas. She has an 18-month-old granddaughter who was born prematurely with significant medical problems. And so she was within a month of hitting the lifetime cap that her family was facing. And so having the ACA helped them to carry over to when the lifetime caps became illegal. And then the other first person that I want to share is Emmy from Nebraska, whose 20-year-old daughter was able to continue with family coverage, again, a college student, because the provisions allow young adults to stay on their parents' coverage until they're 26 years old. She was able to actually obtain surgery that she needed as a college student. And the stories go on and on. Whenever we put out a signal to say we're going to talk about healthcare and voting, we get flooded with current stories, people reliving the old stories before there was the ACA. And, we're reminded that 135 million people in the country have pre-existing conditions, right? And so this will impact so many people during a pandemic that is just, it's unimaginable what could happen to everyday families. And it really helps us understand that what's at stake in November is really our very lives.
That's exactly right. We've got 135 million Americans with pre-existing conditions as of today, but we don't know how COVID and coronavirus are going to affect millions more in the months and years ahead. And so that number is just unfortunately going to expand. Jacqueline, healthcare voters know that reproductive healthcare is a human right. Can you talk to our viewers about some of the attacks on this fundamental human right we've been facing from the Trump administration and its allies, both nationally and locally? I mean, because part of this is, people use birth control for various reasons, right? Including not just to prevent pregnancy, but because of whatever else they may be having within their system, and the birth control, the hormones and so on are helpful. So I'd love to hear you talk about some of the attacks that the American people have been facing.
Yeah, thank you so much, April. It is really important to remember that everybody loves someone who has had an abortion. Our friends at National Network of Abortion Funds sell that t-shirt because it's a reminder that we don't need to stigmatize basic access to reproductive health care. Unfortunately, right now in this country, it depends on your zip code, whether or not your constitutional right to abortion actually exists. We've seen so many attacks from the states as well. Actually, since 2011, there have been 480 restrictions passed at the state level, bans on insurance coverage of abortion, bans that have required additional 2-day waiting periods, bans on medication abortion. And right now, there are 5 states that actually only have one abortion provider in their state left. That's Mississippi, Missouri, North Dakota, South Dakota, and West Virginia. And what we have seen is that really the Trump administration putting Brett Kavanaugh on the court just a couple of years ago emboldened these states. Since Kavanaugh has been on the court, we actually have seen more states in 2020, already in 2020, over 280 bills that are restricting access that have been introduced because there is a coordinated effort to move anti-abortion legislation up so that it will eventually reach the Supreme Court in an effort to try to chip away and undo the protections of Roe v. Wade. And in fact, right now, we have 17 cases that are in the pipeline. So they've worked their way through the state legislatures. They've been challenged at the lower court level, and they're in the appellate level where they could potentially go before this Supreme Court. Those 17 cases, and who knows what else is not the only thing we've seen from the Trump administration, as they put more and more lower court judges who are very conservative and hostile to reproductive health care. It's really worked to restrict rights and access. We also have seen that just this year, during the initial breakout with COVID-19, during the pandemic, particularly March and April of this year, we saw about 9 states who were using the crisis of the pandemic to effectively ban abortion by interpreting state executive orders that would have required postponing or not allowing for non-essential procedures and designating abortion as non-essential. And in the end, abortion did resume in all states because Planned Parenthood Action Fund litigators, as well as our partners with the Center for Reproductive Rights and ACLU, had to bring those litigate those cases to talk about the impact on patients. But what chaos and confusion it is right now in order to get access to care. I'd love to tell you about Jasmine, a patient in Planned Parenthood in Louisiana, who had to drive hundreds of miles in the middle of a pandemic. The only clinic that she found, she was bamboozled by a fake clinic who were giving her misinformation. And she told me she was not going to allow herself to be shamed, to expect people to respect her choices. And these restrictions are so onerous. Jasmine had to make the decision to get into her car and travel 300 miles, arrange for childcare, have a 48-hour waiting period, which means that was additional time off work, and finding a friend to drive back. So right now, unfortunately, the access to constitutional right to abortion is a tale of two experiences that depends on your zip code. And what's at stake with the Supreme Court is we're only going to see Black and brown folks, LGBTQ folks, lose increasingly more and more access. So it's so important for folks to understand there are so many things on the line with this vacancy. And really, your voters, healthcare voters, are the ones who are going to be speaking out.
Absolutely. Monifa, can you talk about how these attacks Jacqueline just outlined are going even further than hurting individual women and people of marginalized gender identities, and they are hurting American families?
Yes, absolutely. I mean, one of the things that people don't think about is how we would lose Medicaid expansion. So entire families and communities really rely on Medicaid. One stat that people are always shocked to hear is that half of all births in the United States are covered by Medicaid. You know, this is a lifeline to people to make sure that they have access to safe and healthy births and so much else. And Medicaid expansion has actually, over the past 4 years, prevented 20,000 deaths. So these are the types of things, again, it doesn't just impact the individual, it really impacts its entire family and the community. And when there's instability in healthcare, the part that people forget about a lot is how it creates economic instability in the family and in the neighborhoods that are most impacted, right? When you are bogged down with health bills, you know, if you have pre-existing conditions and you lose your housing is unstable, that makes communities overall less stable. That makes communities overall less safe. And so we really have to think about this, not just the personal health piece, but the public health aspect of fighting for and maintaining the ACA, protecting the reproductive rights, you know, that Planned Parenthood and others are fighting for so strongly, and also Moms Rising, and making sure that all of the healthcare that is at stake in November because of the decisions that will come up around the ACA are protected. But I cannot underscore it enough Medicaid expansion. And I also want to say another piece that's connected to Medicaid, which is the maternal mortality crisis that I mentioned earlier. Right here in Brooklyn, where I live just a few blocks from Woodhull Hospital, where just this summer, there were 2 maternal deaths. Sha'Asia Washington, she's a young woman who gave birth, perfectly healthy 26-year-old. And what we're finding is that Black women and Indigenous women across the country are 4 times more likely to die in childbirth than white women. And so we know that a lot of that has to do with the racism that is throughout the system, that women are not listened to. But there's also a healthcare access component. And we know that our communities need access to more healthcare, not less. And when we lose abortion care and we lose the ACA, we will exacerbate the already existing medical apartheid that's happening, that's claiming the lives of so many Black mothers.
That's exactly right. And we've got folks chiming in on Facebook to talk about exactly what both you, Jacqueline, and you, Monifa, have said. Clarence Weaver on Facebook says, vote, vote, vote. There are many people in the Black community with pre-existing conditions. Can we talk about how these issues are specifically affecting the African American community? And Monifa, I'd love to go back to you to start with that.
Yes, just like we saw with maternal mortality, COVID mortality also disproportionately is impacting Black communities, Latinx communities, and Indigenous communities. And again, much of that is because of the exposure, more likely to be essential workers, less likely to have access to PPE within whatever work it is that you're doing, but also the medical apartheid, the discrimination that happens throughout the healthcare delivery system that we know happens really even when you control for things like income, education. And so, yes, vote, 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 because not only are we going to have to make sure we protect the ACA, that we protect Roe, but we are still going to be in a pandemic. You know, like coronavirus is not disappearing at the election or at the inauguration. So whatever new administration comes in, we need to be able to demonstrate the power we leveraged. I'm thinking positively, to put the pressure on the new leaders in Congress so that we can continue to get relief. Our communities, I love that question, Black communities, Latinx communities, Indigenous communities need relief, and we need to make sure that the bulk of the relief doesn't go to big corporations like we've seen happen and we see proposed right now by some folks in Congress. We need that on the ground, and there needs to be an equity framework so that the communities that need it the most get what they need.
That's it. I want to ask this question to both of you and start with Jacqueline. Jason Denton had a great question on Facebook. He asked, what is Planned Parenthood and Moms Rising doing to respond to and perhaps delay the Supreme Court nomination of Amy Coney Barrett? And how can folks get involved? Jacqueline, to you first, and then I'm going to come to Monifa.
Yeah, thank you so much for that question, Jason. I think it's really important to remember that these issues are extremely popular. The senators who are considering voting for Amy Coney Barrett are not reflecting the values of their constituents. That's why it's so important to get involved. So I love this question. We actually know that 77% of Americans do not want to see Roe v. Wade overturned, and yet this nominee is a threat to Roe. So we know that this is a battle that everybody should be a part of. It's going to impact voting rights and healthcare access, food security, clean water, LGBTQ equality, and safe housing, all issues that are going to be particularly important for Black and Brown people in our communities who are already suffering from unfair laws and injustice. So what we at the Planned Parenthood Action Fund are asking for folks to do is to join us in this effort. Maybe you can call your senators every day if you want to be able to make sure that they hear from you about the importance of delaying this, filling the vacancy until after the inauguration. And if you want to get involved and get updates from the Planned Parenthood Action Fund, you can text the word RISE, R-I-S-E, text RISE to 22422. So that's text RISE to 22422.
Fantastic. Thank you for that. Monifa, please tell us what Moms Rising is doing to respond to or delay the SCOTUS nomination and how folks can get involved.
Absolutely. Well, we have a saying at Moms Rising is that it ain't over till it's over. I think a lot of people feel like it's a foregone conclusion that the Senate is going to decide what the numbers look like. And that may very well happen, but we want you to join us in making sure they hear from as many of their constituents as possible that that is not what we want them to do, that we want them to hold off confirmation until inauguration. And maybe you can join us in our text campaign. You can send emails to your senator. And I agree with Jacqueline, if you can call them every day, they may make the wrong decision, but they will hear from us, and we won't give up until that decision is made. And we keep pushing that every day, because a lot of times, especially with the 24-hour news cycle, people can think that, the race is already won. The same with the election. The polls will say one thing and then people stay home. Look, it's not over until it's over. Now's the time to lean in. Also, Planned Parenthood, Moms Rising, and 70 other national women's organizations are looking to mobilize in the streets next month. This confirmation means everything to us. I wake up in a cold sweat at night thinking about my grandmother saying, "You let this happen on your watch, you young ladies," right? We cannot let the clock turn back from what our mothers experienced to things being worse for our daughters. And so you will see that reflected in the streets. Join us. If you want the most recent information about the march, go to the Women's March website. If you want to join on to text, call, and email your senator, go to momsrising.org, momsrising.org, and sign up so that you can get alerts from us.
Thank you so much, Monifa and Jacqueline. I would love to talk to you for the next hour and a half, but I truly appreciate your advocacy, your vulnerability, your inspiration, and giving us direct action items that we can take from this web series and put into practice. Now it's time. April. Thank you, Monifa. Thank you, Jacqueline. Now it's time for our final segment of the show, What's at Stake, where we'll welcome experts to join us and tell us about what's at stake for our healthcare in the courts, especially in the context of gender identity and expression. So welcome to Chris Kang, the co-founder and chief counsel of Demand Justice, Elizabeth Wydra, the president of Constitutional Accountability Center, and Daniel Goldberg, the legal director for the Alliance for Justice Action Campaign. I'm going to first ask all of you the same question our guest before. And Chris, I'd like to start with you. What makes you a healthcare voter?
Sure. I think that at the very basic level, I'm a healthcare voter because healthcare is a human right? When we think about everything that's on the line, access to affordable healthcare is a racial justice issue. It's an economic justice issue. It's a gender justice issue. All of the ways that we look at establishing equality and justice in every aspect of our lives, healthcare and access to affordable healthcare plays a huge role. Growing up for me, both of my parents were school teachers, so they belonged to a union. We had good healthcare. That's not an option for everybody anymore. And I think that it's important for those of us who don't have something literally on the line through the Affordable Care Act to recognize how privileged we are and how important it is that we are just one bad Supreme Court decision away from 20 million Americans losing healthcare during a pandemic. And as Monifa and Jacqueline talked about, more than 130 million Americans with pre-existing conditions, those protections can be ripped away. And so that's really why I think healthcare is going to be one of the most important issues that drives me to the polls this year.
Oh, I absolutely agree with that. Elizabeth, I'd like to come to you with the same question. What makes you a healthcare voter?
I mean, how can you not be a healthcare voter? Look, we all need to have access to quality, affordable healthcare in order to thrive, in order to take care of our families. I think about, as a mom, as a daughter, for myself, you really can't build your life and dream and control your own destiny if you don't have access to what can make you healthy, not just in times of crisis, but to help our communities be healthy every day. And it's incredibly important. And as Chris said, it is terrifying that we're one bad Supreme Court decision away from this access that people have fought so hard to be established in the Affordable Care Act being ripped away from tens of millions of Americans, especially in this time of pandemic. So I guess I would add to that, I'm a healthcare voter and I'm also a courts voter, which I know we're going to talk about a little bit more.
Absolutely. We're getting the twofer with you. I like that. Daniel, find out the same question to you finally. What makes you a healthcare voter?
I think Chris and Elizabeth and the others on this call has so eloquently stated what it means to our fellow countrymen, that if a child is sick, they have the ability to take that child to a doctor, to a hospital. If an elderly family member, a grandparent needs vital care, they don't have to worry about losing their retirement funds in order to get the needed medical care they need. If an individual right now comes down with the COVID virus, that in the future they won't be denied health insurance or see skyrocketing health insurance rates merely because they worked at a meat packing plant that did not have safe working conditions. That really, as everybody else has said, the ability to be economically secure, to make sure that our family members, when they get sick, can see the doctor and receive the medical care they need, to make sure that we as a country recognize that an important part of our social contract to our fellow citizens is that we are all safe, healthy, and able to exercise this incredibly important right, which is just to be safe and in many cases alive. And as Elizabeth also said, it really, I'm not only a healthcare voter, I'm a court voter, that right now, whether millions of people, including persons with pre-existing conditions, will have access to quality, affordable healthcare, is right now going to come down to 5 justices on the Supreme Court. So it really, the stakes could not be higher over the debate we're having here in Washington over the next month as to whether millions of people will be able to access affordable healthcare.
Absolutely. And I'd like to stay with you, Daniel, for just a minute and ask, can you walk our viewers through the Republican healthcare repeal lawsuit, California versus Texas, and what it means, especially in the context of gender-specific healthcare?
Well, I think the important thing to remember is for a century, the Republicans have been fighting efforts to provide quality, affordable health care to our most vulnerable citizens. They opposed Medicare, they opposed Medicaid, they opposed Social Security going back to the New Deals. They were relentless in their attacks on the Affordable Care Act. And did everything they could to prevent Barack Obama, Joe Biden, and the Democratic Senate and House from enacting and providing critical protections for millions of people. And sadly, they did not accept that law after it passed. They continued to be relentless in bringing one lawsuit after another, seeking their Republican appointed judges to repeal and do their dirty work for them, take away health care from millions of people. They could not do it in the House and Senate. So they want their unelected judges to do so. The latest lawsuit is a lawsuit which argues, and I think I got this theory correct, that when John Roberts upheld the Affordable Care Act, he did so by saying that the individual mandate was a tax. As part of the 2017 tax reform legislation that Trump and the Republican Senate enacted, they lowered that tax amount. They eliminated the monetary part of the individual mandate, so it can no longer be a tax. And so the individual mandate is unconstitutional. Therefore, it cannot be severed from the rest of the law, and therefore the entire law, including protections for people with pre-existing conditions, including Medicaid expansion, including anti-discrimination provisions to protect women and LGBTQ Americans, that the entire law is unconstitutional because the individual mandate is now down to 0. Quite frankly, Lamar Alexander, it's called this a far-fetched theory, but 3 Republican lower court judges have already accepted it. There is a real shot that they get 5 Supreme Court justices, especially if Amy Coney Barrett is confirmed to do so. Donald Trump has said one of his litmus tests is every judge he will nominate will overturn the Affordable Care Act. So this is a real threat to the well-being of millions of people.
And Elizabeth, Daniel just mentioned Amy Coney Barrett, and given President Trump's recent announcement that he's nominating her to fill Justice Ginsburg's seat on the Supreme Court, what does her potential nomination and confirmation mean for our healthcare and our country?
So it's huge. You know, look, this healthcare is on the ballot. Abortion rights are on the ballot because the Supreme Court is on the ballot with this election. And you know, it's, I think Jacqueline mentioned earlier that healthcare is very popular. And so the senators who are faced with the Barrett nomination are, you know, getting pressure on them, and we have to keep up that pressure. It's also because the Affordable Care Act is popular and because the majority of Americans rightfully support the constitutional right to reproductive freedom, including the right to choose abortion. It's because these are so popular with most Americans, maybe not with the base, conservative base, that they're trying to appease their base through the courts because they couldn't get rid of the ACA because there was a lot of political pressure put on Congress to retain it. And by getting folks like Amy Coney Barrett and to have her replace someone like Justice Ginsburg, who was such a champion for healthcare access, as well as understanding the way that access to healthcare, including abortion, can help women and all people thrive and actually enjoy meaningful equality. So to get to a point where they can get rid of the Affordable Care Act, where they can get rid of abortion rights, they're replacing progressive justices like Ginsburg with people like Amy Coney Barrett, who, as Daniel mentioned, Donald Trump promised he would only appoint people who would be willing to get rid of the Affordable Care Act, who would only be willing to strike down Roe versus Wade. So even without looking at her record, we already have that cloud over her. And then when you look at her record, she said that Roe versus Wade was an erroneous decision. She has criticized the Supreme Court's rulings that have upheld the constitutionality of the Affordable Care Act. So everything that Donald Trump promised seems to be manifest in Amy Coney Barrett, and that is to the detriment of all of us who care about healthcare and all of us who care about being able to exercise our own reproductive freedom.
Absolutely. Chris, how are advocacy groups like Demand Justice applying what both Elizabeth and Daniel just shared about this particular lawsuit and just lawsuits winding their way through the courts generally and mobilizing people in defense of our healthcare?
So this is a much bigger moment than we thought it would be in terms of defense of our healthcare and defense of the courts. You know, Demand Justice and a whole slew of organizations are coming together. You know, we're running ads on television. Demand Justice just announced a 7-figure ad buy yesterday, where we're in particular up in states where senators are either going to vote the right way or hear from their constituents in November. So we're up in Arizona and Colorado and Iowa and North Carolina. We're working with a lot of partner organizations to talk to senators in state, because there are a lot of them are going home during this time, and make sure that they know that their constituents are upset. We're sort of dialing up the phones, faxes. March for Our Lives is faxing senators, sort of finding any way to make sure that their constituents' voices are heard. And then a lot of it's also working with senators to make sure that the Democrats make the case that this is an illegitimate process and an illegitimate nomination. So some of this is about Amy Coney Barrett. As Elizabeth said, she has a strikingly public record in which she says that she would strike down, or that she thinks Roe versus Wade is erroneous. She's on the record criticizing both Supreme Court decisions that have upheld the Affordable Care Act. And yet this fight really is about the court overall. It's about the fact that we're not just weeks away from the election. The election is here. More than 1 million people have already voted. The will of the people has to be heard. And for Donald Trump and Republicans to just ram this nomination through makes the entire court illegitimate. And what they're trying to do, again, is achieve these policy goals that they can't achieve any other way. They can't get it done through Congress. They can't get it done through the White House. So they're trying to use the courts and hope that Americans aren't paying attention to the courts so that they can get it done. And that's why this fight is so important.
And I'd like to stay with you, Chris, because Zach on Facebook had an interesting question. You mentioned making sure that we're contacting our senators. And Senator Mitt Romney recently said our nation is center right and that a liberal court isn't written in the stars. What would you say to him?
Well, I don't know that I would say our country is center right, but I will say this. Republicans have had control of the Supreme Court for the past 50 years. Even though Democratic candidate has won the popular vote for the presidency 6 of the last 7 times. Regardless of what happens in this election in November, if they're able to confirm Amy Coney Barrett, Republicans are going to control the court for the next 30 or 40 years. This is not a democratic, small d democratic institution anymore. It does not reflect our country. And you look at what they're trying to do, it's not just that they're trying to strike down the Affordable Care Act. It's not just that they're trying to overturn Roe versus Wade, but on issue after issue, from preventing gun violence to LGBTQ equality, to allowing the government to address climate change, these are issues that are 80% of the American public agrees with. And this Supreme Court with Amy Coney Barrett is going to be an obstacle to all of it for the next 30 or 40 years. And that's clearly not representative of where we are as a nation.
And April, I just want to add on to what Chris said. You know, look, a liberal court may not be written in the stars, but the progressive promises of equality and access and inclusion that healthcare and access to reproductive choice are based on are written in the Constitution. And so what we are asking for is a justice to be nominated to the Supreme Court, a judge to be nominated to the bench on any court, who will follow the Constitution's promises of equality and justice for all, for everybody. And what we're getting from the Coney Barrett nomination, I fear, is someone who is follow a policy agenda instead of those progressive promises of the Constitution, because they might not fit with the president who's nominating her and the party behind him's policy agenda.
Well, I think that's right. And in fact, Sue on Facebook pointed out that in the presidential debate just last night, Trump came right out and said, I have 6 judges, calling judicial neutrality into question. Elizabeth, do you think this kind of politicization calls for structural court reform?
So I think that, you know, if we have a confirmation before inauguration, it could deeply affect the public's faith in the court. And then we have to think about what can we do to try to restore that faith. And so if that means expanding the number of justices on the court to enhance its legitimacy, to make it seem to the public as if it is the institution that was promised to us, the impartial arbiters of justice, then that's something to look at as well. And I would just say that if the court does get drawn into an election dispute, and we had Trump again last night suggesting that that's why he wants to rush through a Coney Barrett nomination so that he'll have 6 justices, he thinks, in his pocket on those election disputes. I mean, man, that really calls into question the legitimacy of the court. And that, to me, as a Supreme Court lawyer and someone who cares about our institutions, that is very frightening.
I agree. Daniel, I wanted to quickly share some of the conversation we're seeing online right now. Sarah shared her story as a woman with a pre-existing condition. She suffers from depression and generalized anxiety disorder. Some folks are now debating in the comments if Trump will protect people with pre-existing conditions. And what do you think, Daniel, in light of Trump's recent executive order?
The answer is no. Donald Trump has a healthcare plan. He keeps promising a healthcare plan. It doesn't come 2 weeks later. He keeps promising another healthcare plan. They have promised a repeal and replace for a decade. The reality is they do have a healthcare plan. It is to pack the courts with judges who are committed to taking away healthcare from millions of people through the courts by invalidating the Affordable Care Act. Donald Trump's Justice Department, which is charged with defending acts of Congress, is in court arguing that the entire Affordable Care Act should be struck down and people with pre-existing conditions should lose vital protections. He has made clear that a litmus test of his with every judge is that they will overturn the Affordable Care Act. The stakes could not be higher with this vote, this upcoming confirmation vote. And I want to go back to the activism that Chris alluded to. This is not a foregone conclusion. We remember that when Republicans took control of the House and the Senate and the White House, people felt that the Affordable Care Act was going down, that the Republicans would have the votes and there was nothing that anybody could do about it. But millions of people literally stormed the Capitol. People with pre-existing conditions were in senators' offices and made clear that if you vote to repeal the Affordable Care Act, my family member will literally suffer health, potentially die. And John McCain put his thumb down and the Affordable Care Act survived. Between now and Amy Coney Barrett's confirmation vote, if all we need is 4 Republican senators to go to Mitch McConnell and say, this process is illegitimate, it is a sham, and I cannot go back before my voters and vote for somebody who will take away healthcare from millions of people in the middle of a pandemic. If we can make this an up or down vote on healthcare in the middle of a pandemic, for the millions of people storming the Capitol like they did several years ago to keep the Affordable Care Act in place, we can defeat Amy Coney Barrett, and we can make sure that it is indeed the next president in January who gets to fill Ruth Bader Ginsburg's seat.
Absolutely. Chris, I want to end with you. Joe on Facebook says, this year, Wall Street was given $1 trillion in assistance, but Republicans aren't funding health care for millions of Americans. What do you think quickly that this says about this administration's priorities?
Sorry, I lost you. Did you say you want to end with me?
I did, if it's possible, yes.
I lost who you wanted to end with. So I think that is also one of the most important pieces here. We talk about the hypocrisy of Republicans ramming through this nomination after stealing a seat from President Obama in 2016. We talk about what Amy Coney Barrett would mean in terms of the Affordable Care Act and access to abortion. But I think the other huge piece of this is the Republicans' misplaced priorities. You look at the fact that they have stopped legislating with respect to this pandemic months ago. The House has passed legislation that would provide critical aid to states, to schools, to cities, to boost our economy and small businesses, and Senate Republicans refuse to consider it. You look at the summer we've had and the reckoning on racial justice and criminal justice and police reform, and yet this Republican Senate refuses to consider it. You look at the crisis that our post office is facing. This Republican Senate refused to consider it. What are they making time for? They're making time in these closing days before the election to ram through an illegitimate nominee. And they're doing it just so Donald Trump can have a justice, in his own words last night, to count the ballots, to look at the ballots, he said last night, and to take away the Affordable Care Act. And I think that says everything that voters need to know going into November.
Absolutely. Daniel, Elizabeth, and Chris, thank you for joining us today and sharing your expertise. I know I learned a lot, and I'm sure our viewers have too. Before we wrap up this evening, we're going to hear from Senator Chris Murphy of Connecticut about what's going on in the Senate around Trump's Supreme Court nominee. Senator Murphy, thank you for joining us today, and I'll hand things over to you.
Great. Can you hear me okay? All right, awesome. April, thank you for having me on. I'm sorry, I'm just rushing back from votes on the floor of the Senate. But let me thank you all for putting this together, for making clear what the stakes are. I caught the very end of this last set of remarks, and I think this idea of inevitability is a problem. It's a bubble we have to pierce. There are a lot of folks who think this is a done deal, and I just remember what we did 4 years ago. I mean, there was no way that Republicans, having pledged to repeal the Affordable Care Act for 6 years, were not going to follow through, having won the House, the Senate, and the presidency. There was no way that they wouldn't succeed in their number one priority, and they didn't succeed. And they didn't succeed for one simple reason. because the citizens of this country activated. They turned out in droves, and they made it clear to enough Republican senators that if you vote to take away my health care, there will be consequences to you. And what I think we forget about that moment is that, on that day, there were 3 Republicans that were willing to do the right thing. That was just a procedural vote. The reason that Mitch McConnell abandoned the whole effort after that late night vote was because he had 6 or 7 other Republicans that were not likely going to support the final repeal effort. And so it just underscores that, we need 4. In that fight, we had well more than 4 that ultimately didn't want to imperil their own reelection in order to take away people's health care. And so we have to make that clear as well. So I'm going to do everything that I can on the inside, but I know that our success in defeating Amy Coney Barrett is dependent on what you do on the outside. And I'm sure this has been covered, but I sit on the Health Education Committee, and we had Dr. Fauci before us last week. And I asked him, listen, what do we know about the long-term health consequences of COVID-19? And what he said was chilling. It was truly scary, right? These reports that 70 to 80% of people who have COVID have long-term damage to their heart, all sorts of long-term potential effects on your brain, on your lungs, on your vascular system. There is no doubt that COVID-19 is going to be a pre-existing condition that may be so serious that you can't get healthcare if the Affordable Care Act is gone. And so who knows how many people in this country have COVID, right? We're registering about 50,000 new cases every single day, but we know that is a dramatic undercounting, right? It could be as many as 500,000 people a day are contracting this virus and are asymptomatic. And so that in and of itself is a humanitarian catastrophe. If Amy Coney Barrett gets on the court, is the vote to invalidate the Affordable Care Act, and that results in and of itself in COVID disqualifying millions and millions of people from insurance, in addition to being disqualified from insurance if you have a host of other diagnoses. So in this moment, as we try to respond to this pandemic, we have another reason why we cannot allow for another radical justice to get on the Supreme Court that will do what the Republicans couldn't do legislatively. They couldn't do it through the most sort of representative branch of the government. So they're trying to do it through the back door in the courts. And I'm just glad to be able to wrap up today to give you a little bit of a view from the inside of the Senate. I worked that ACA repeal hard. And as the phones lit up, as social media was being dominated by the anti-repeal crowd, it made our job a lot easier on the inside. This is not a done deal. This is not inevitable. If we mobilize, we can convince enough Republicans, especially those that are up for re-election, that they don't want to jeopardize their political future by taking away healthcare for 23 million Americans. So thanks for what you're doing.
Thank you, Senator Murphy, for sharing that important context. I mean, I think that the overarching theme that we've heard today is that it's almost one of inspiration, right? We're not over. It's not over. And so we all, as American citizens, need to call senators, especially those that we think may be on the fence about how they want to proceed, and implore them to save the Affordable Care Act and to wait with respect to the nomination of Amy Coney Barrett. With the election nearing this close and the subsequent arguments before the Supreme Court regarding the healthcare repeal lawsuit just days afterward, there's so much at stake for the health of our nation. Join us next week for another Instagram Live conversation with Anushka from Healthcare Voter and special guest, Senator Cory Booker from New Jersey. Senator Booker and Anushka will be discussing Black maternal health outcomes, and you will definitely want to tune in. That's next Wednesday at 6:00 p.m. Eastern Time. And for more information on this web series, please visit healthcarevoter.org/what's at stake. You can also follow us on all social media platforms, Twitter, Facebook, Instagram at Healthcare Voter. Thanks for joining us, everyone, and we will see you next week at 6 p.m. Eastern Time.